presentation about the promotion of active living and safe exercise. I'm hopefully going to critically evaluate the role of exercise professionals and their promotion of active living, and demonstrate understanding of the nation's health and an insight into exercise referral scheme. So, current climate at the moment. Okay, we're just going to look at obesity first of all. So, WHO 2012 says the world is getting heavier, and that's definitely proven in this little diagram I've got here, which is looking down at Europe in particular. We can see more so men, in actual fact, more than women, but you can see that the UK is in one of the higher ends of having a higher BMI. It's 2.8 million people each year die as a result of being overweight. And between 1980 and 2008, prevalence of obesity is almost doubled. So the highest premature mortality rates in the UK countries were in Scotland at the moment, and substantially higher than England. But if you just look at the next slide I've got here, just drilling it down into our local area, you can see how the percentage has changed from 2007 to 2012. So it is gradually increasing. So in Wales is actually slightly lower than England, and in actual fact it's women in Northern Ireland that have one of the highest percentages of obesity around this area. So now we're just going to look at the deaths caused by some obesity diseases. So we've got coronary heart disease, 20%, 10% stroke. That's for males, and then drilling down even further, it just gives you a nice diagram here in the UK. So these European figures here, stroke 22% for this is for females, stroke's 15, and other like injuries which aren't anything to do with obesity necessarily. And it drills it down even further into the UK, 28% from cardiovascular diseases as a whole. In 2013, more than 307 million prescriptions were prescribed for cardiovascular diseases in England, which is more than 6 times as many issued in 1981. So we're prescribing more things, but this doesn't include exercise at all. Those figures. So anxiety and depression, about a quarter of all population will experience some kind of mental health, and it's 29% of females compared to 17% of males, but that's obviously something to do with going to the doctor and being able to talk to the doctor as easy as a woman would go. A woman is more likely to go to a doctor with other complaints and issues. Also diabetes, COPD. Recent estimates suggest that over 900,000 cases of COPD in England and Wales, and undiagnosed up to 1.5 million. So that's just exactly what's happening currently at the moment. So, physical activity and health. Adults who are physically active have a 20 to 30% reduced risk of premature death. So, physical activity has been proven to make an impact on all the conditions that I've just spoke to you about. 3% of all disease burden is due to inactivity in the whole world as well. And in the EU, 39% of adults were reporting to have never participated in any physical activity at all. But in England, low levels of physical activity could be cause for 36,815 premature deaths. So, but when we're comparing in different countries, it's hard to make a true comparison due to data that's there, but if we're comparing things such as culture and weather, we are one of the lowest countries, with like Scandinavia being one of the highest, so they're in comparison, so they're getting what we need to channel in to see what countries like that are doing. Recommendations, as we know, Department of Health 2011, adults should aim to be active daily over a week, 150 minutes to 2.5 hours, but that can be split into bouts of 10 minutes at a time if necessarily. Again, Scotland's come down with one of the lowest active rates in particular. Nature England and Play England have actually come together to promote informal forms of physical activity and use of green spaces, fully supporting the government's guidelines to increase the number of children as well who are doing active physical activity, and they should include games, swimming, all things that can help maintain healthy weight and lower the figures with the diseases. This is just a little graph I've put in there which is explaining about occupations and the rate of physical activity. So as you can tell, professionals do have a higher rate of physical activity, possibly down to the able to pay for the gym memberships that come often they're quite highly priced. We've got manual unskilled. Do they have access to the information? Are they able to go on the internet to source local gyms, local initiatives, things like that? So that's really a good one to see that how your occupation does impact on the physical activity that's out there. So, exercise professionals, all different types of exercise professionals out there: GPs, health trainers, health visitors, mental health professionals, midwives, practice nurses and physiotherapists. First of all, we're going to look at gym instructor level 2s, and then we're going to go straight onto level 3s. So level 2s, when you're to complete a course, so most level 2 gyms, most gyms require at least a level 2 for you to be working there, and that gives you the ability to program for healthy adults and general supervision of people in there using the equipment. They can't work with special clients, special people with medical problems, special populations, not special clients. And most people will hold a level 2 certificate in instructing. They'll earn on average like £12,000 to £14,000 a year, working 5 days over the week. If you was to study gym instruction level 2, these are just some of the points that you will cover. So you can see they're quite basic, just looking at muscles, bones, the environment, health and safety, very basic things that you would use when working with somebody who had no health conditions at all. If you was to undertake that in college, it could take between 9 to 10 months. A prerequisite would, for a 16-year-old, would be 18 GCSE, but they would have to start on a level 1, if not, working up to a level 2 qualification. There'd be a full-time course, at least 3 days a week, and a mixture of practical and theory. And if you was 16 to 18, that'd be funded for you. Otherwise, a mature student could come in and do the same course for around £2,000. However, you could do this for a private company on the internet, around £500. You could qualify intense course within a week, or over distance learning and have a couple of practical sessions. Both will have the same accreditation through CYQ, REPS accreditation, and have 20 CPD points if you were to get registered through REPS. And have your certificate, regardless of where you studied, will both say, it won't say where you've studied, it will just say, sometimes it wouldn't say this was done in an intense course or it was done on a year course, it just says that you are qualified. Again, with the personal trainers, I'm just going skipping along there. I'm going to go more into this, but this is a brief overview. Again, they go slightly deeper, but again, with nothing with anybody with specific health issues, but they're looking how to do an exercise program to manage weight, can give advice on nutrition, injury prevention, and perhaps rehabilitation, but on a healthy individual if they've caused an injury through exercise in the past. They could work freelance in a gym, be employed through the gym, or work self-employed. They can qualify again on a 3-week intense course for around £3,000 on an internet, or you can come to college, do it for over 9 to 10 months, both getting the same qualification, but through the college you would have the expertise of lecturers, and who are probably higher trained, because all you need is a basic teaching qualification and an actual level 3 to be able to deliver training to personal trainers, whereas in colleges a degree is the minimum they would require from you. So again, these are what sort of things you would cover, how to design, manage and adapt an exercise programme. There are over 7,000 accredited and qualified people who have done short courses at personal trainers at the moment. So if we're going a bit more critically, looking at the personal trainers and the level 2s, a leading physiotherapist, Sian Woodcock, stated in 2009 that there's been a significant rise in the number of patients the physiotherapists have seen through injuries during sessions with personal trainers. That could be possibly because the individual who's getting trained isn't telling the personal trainers how they're feeling, but it also could be that they haven't had sufficient training. This might be a result of their knowledge. Some personal trainers will have undertaken the short course, like I've just said, while others could have gone to university, done a science degree. Gordon, 2009, who's an exercise and nutrition specialist, states that exercise professionals cannot be produced on a two weeks or 6 weeks or even 12 weeks intense course. But showing you the certificate means that a lot of people actually buy into what they're saying. In his opinion, it needs at least 2 years of intense coursework to be qualified enough to tell each person on a case-by-case situation what they need to be doing. Lippincott, 2013, wrote in the ACSM guidelines that there is an increased risk of sudden cardiac death with rigorous exercise, and that can be with a healthy individual. And both level 2 and 3s don't have any specific training about an individual and the rigorous exercise risks that come with that. So there are certain associations and registered bodies that are there to supposedly look out for both the level 2s and 3s. As of November 2014, there was 13,000 registered REPS members, and their chief registrar says that their standards are being reviewed regularly, but she did point out that REPS membership is voluntary and it's something that you can pay for. Okay, there are other companies here that focus on like Skills Active, for example. Skills Active's main goal is to establish career pathways and to keep talented and knowledgeable people within the industry. So when you go for a course and you see that's there, you know that's accredited by that. Level 4s, just briefly, we're going to touch on that. National Registered Personal Trainers, you can pay for that, but again, it's same as REPS, it's only something that you can pay for, and they supposedly have higher standards than REPS. Level 4 is where you can take it into more specific, so diploma in specialist exercise. You do have your prerequisites of having a level 3 for that. Lower back pain. One particular we're going to talk about is obesity and diabetes level 4. It's a £500 course for 4 days face-to-face. And with that you talk about exercise referrals and a detailed tailored long-term strategies for people with obesity and diabetes. But looking more so at GPs themselves, if we just scoot onto here, we can see that 1 in 4 physicians feel they receive adequate training and counselling on patient diet and physical activity. 1 in 4 medical visits in counselling. So here, as a doctor in training, there'll be about £22,000 a year, and it can take 7 years to become a doctor with all that basic knowledge. Few of these doctors' few doctors actually meet the Department of Health recommendations as medical students when studying, and it's found that they then go on to do even less as practicing doctors. I've got a study here from 2008 that suggests medical schools need to increase the proportion of students adopting and maintaining regular physical activity. Yeah, rates. Long-term conditions, right, sorry, I'm just finding something on about here. NICE 2014 identified adults who are not currently meeting the UK guidelines and said its doctors are not actually telling them about the guidelines. Use of professional judgment should be used to determine the people who are most need it, and they should be taken on to refer to specific tailor-made plans for them. Liberto 2008 suggests doctors are well positioned to provide physical activity counselling to patients. They're a respected source of health-related information and can provide continuous preventive counselling. However, the barriers there is that a lot of doctors are saying they feel weighed down by protocols and bureaucracy. There's compelling evidence that doctors, like them said, don't specifically carry out to do the physical activities, so therefore can't be a positive influence on the clients. In a questionnaire that was sent out to practitioners, health professionals' knowledge of physical activity and the routines that they should advise and associated attitudes, confidence and enthusiasm from them was one thing they felt quite high on. They felt confident in telling them things, but it was just time during appointments. They couldn't fit the time in when dealing with other conditions. And it's actually practice nurses and other health professionals that there's a high percentage of referrals that come from people like that. I'm just going to move on to some health promotions that are around at the moment. Change for Life, NHS midlife checks, they're from the GPs, and a level 4 would be qualified to work on that. Preventative packages for older people, a level 3 and level 4 would be working in that. And Take on Life, a Scottish campaign, is where a level 2 and level 3 would be working with people who was referred to the gym from a doctor. Health promotion is a process of enabling people to increase control over and to improve their health. It moves beyond a focus on individual behaviour towards a wide range of social and environmental interventions. I've got lots of information about these, but I haven't got time to tell you all about that. Health community funds have been set up to try and promote physical activity. So promotion should cement understanding of the threat posed by health issues. This is why doctors and people who are well respected in the community should be pushing that message across. Motivating individuals to embrace change and encourage others around them if necessary. And here's just a diagram of some of the theoretical models that our health and exercise professionals should be using. So for example, in face-to-face groups, so in the actual health referrals, in the referrals, they can be used in the theory of planned behaviour, health belief model is something that's very popular, especially with physical activity. Okay, so just looking at exercise referrals, it's got a quote there from NICE about the physical schemes try to increase physical activity among people who are inactive, and there's some ones that are available here. So, lack of feedback from health professionals of the referral schemes that are out there at the moment are why doctors and other health professionals are saying they're not referring as much. That's the quote that I've got there from. But in New Zealand, they found a significant improvement from their intervention groups. So there's definitely something to learn from other countries, and they have a high participation rate. I've got those to talk about. I'm still allowed to talk about a little bit on.
You are.
Yeah.
If you wish.
Okay. I've got Graham, 2015, suggests that physical activity was not a priority on the major primary care professionals. Some professionals perceive that patients lacked motivation, so they need specific training on how to motivate them. And also, Manchester University found that 29% of patients who were prescribed exercise were able to give up antidepressants, and 92.5% of them had an improved mood. So that's that's proof that it is working. But with GPs issuing antidepressants, that's an actual physical number they can put down on a paper, as opposed to waiting for feedback, which is in short supply, like I said on the last slide. When we're looking at older adults specifically, older adults above 65 and over who have risks of falls and other health conditions, they should be exercising to improve balance and coordination at least 2 days a week. And I've got loads of exercise recommendations, but I haven't got time to go through those. But through the Centers of Disease Control in the USA suggests 2.5 hours, pretty much the same as a normal adult, but recommend under supervision. And some of the places that they could go to for this schemes called in the UK, which work in care homes. They have a number of like over 10,000 older adults per month receiving health advice from at least a level 4 qualified instructor. You can have a level 4 certificate in qualification in exercise and management for lower back pain specifically, as being a must when dealing with older adults. Or you can just go in for an exercise with older adults qualification, which can be a 2-day face-to-face course. We've got other campaigns as well at the moment, but I'm not going to go into that too much. But yes, support and training. Scotland have actually found that a joint improvement team, the instructors on their health referral schemes for older adults, will receive additional training in complex behaviour change techniques for older adults. And just to wrap that up there, just for a conclusion on everything said today, in primary care, there needs to be fully motivated in encouraging the staff, specifically doctors, to be more engaging with the clients and get them on referral schemes. And they need to be able to see the benefits because to increase opportunities as well. I don't know what else to say.
Thank you very much, Jan.
I don't know the time to go for any